Across the country, the Obama administration is working to implement the Affordable Care Act and deliver the security of quality, affordable health care to more Americans. The good news is that starting October 1st, new online marketplaces will allow consumers to go online and compare private health care insurance plans just like you'd compare over the internet the best deal on flat-screen TVs or cars or any other product. And you're going to see insurance companies compete for your business. In states like California, Oregon, and Washington, market forces are pushing costs down. Just recently, New York announced that average premiums for consumers who buy insurance in their new online marketplace will be at least 50% lower next year than they are today. So for people who are self-employed, who have to buy on the individual market, they're suddenly going to see opportunities for even greater savings in their premiums. So if you already buy insurance on the individual market, it could mean thousands of dollars a year in savings. And what this means is that hundreds of thousands of New Yorkers who don't have insurance will finally be able to afford it, because these exchanges, this big pool, is going to reduce the cost. And middle-class families will potentially qualify for tax credits that will bring the cost down even more. So this is just an example of how the Affordable Care Act is doing what it's designed to do: deliver more choices, better benefits, a check on rising costs, and higher quality care. Despite all the evidence that the law is working the way it was supposed to for middle-class Americans, conservatives in the House of Representatives voted for nearly the 40th time to dismantle it. We've got a lot of problems in this country, and there's a lot of work that Congress needs to do, and yet instead we're refighting these old battles. That's ridiculous. Now, if you're one of the 85% of Americans who already have health insurance, it could be through your employer or through Medicare or through Medicaid, you already have an array of new benefits in place. For years, too many middle-class families saw their health care costs go up without much explanation as to why or how their money was being spent. But today, because of the Affordable Care Act, insurance companies have to spend at least 80% of every dollar that you pay in premiums on your health care, not on overhead, not on profits, but on you. If they're not spending your premium dollars on your health care, at least 80% of it, they've got to give you some money back. Last year, millions of Americans opened letters from their insurance companies and were pleasantly surprised with a check. In 2012, 13 million rebates went out in all 50 states. Another 8.5 million rebates are being sent out this summer, averaging around $100 each. And for families that are working hard, every dollar counts. As someone who got their first rebate check said recently, it felt like someone was actually being held accountable for the dollars I was spending on health care. That's one of the core principles of the Affordable Care Act: holding insurance companies and providers accountable so that we all get a better deal. We've got a lot more work to do, but healthcare inflation is not skyrocketing the way it was. This is a big country, and the healthcare industry is massive, and there are tons of providers. And so as we implement, there are going to be glitches, and there are going to be certain states that for political reasons are resisting implementation. And we're just steadily working through all that stuff. In the end, our effort will be a success. Thank you.